Hello, my name is Josh Winans. I did my PE experience at the healthcare resort in Colorado Springs, Colorado. This facility is essentially brand new. It was built in 2015. The facility focuses on a holistic care as well as ease of transition back to a normal way of living. The site specialty focused primarily on patients who've decompensated greatly due to their disease process or who had extended hospital stays. Most of the patients that they have there specifically are dealing with numerous orthopedic injuries, extensive wounds, or weakness just due to decompensation, so they're there for extensive rehab. The site personnel consists of CNAs, RNs, LPNs. The CNAs have 8 to 10 patients. The RNs oversee typically 24 patients, and the LPNs also oversee 24 patients. However, the LPN's primary duty is just to pass medications. There's both mid-levels nurse practitioners who see 10 to 12 patients a day, depending on the workload, and then there's an MD for the site. There's also all the ancillary staff, such as admission discharge planners, mental health workers, admin, marketing, and then obviously environmental services, dining services. The 3 reasons why elders would want to receive care there is primarily first the holistic care. They have numerous activities. They even have a bar. They have live music every night, nearly every night. They also help the elders transition back to how they were living prior, whether that's very socially or if an elder is somewhat recluse and that's how they prefer to live their life. Another reason, the second reason, is the therapy. They do immense amount of PT and OT several times a day with every patient. And then the final reason is the transition to home. They will send personnel from the facility to do in-home surveys for the patient to make sure they're safe and they're ready to go home, and the home is ready to receive them. That kind of leads into the fourth point is how the facility helps elders transition to care. Doing the in-home surveys are immensely helpful. Simply just putting railings in bathrooms, or if they have to remove rugs, flooring, and so forth, they'll work with the resident and help facilitate that. The biggest legal and ethical consideration that I saw was that the providers spent majority of their time digging in charts, looking why the patient was there, and then also spending an immense amount of time doing ICD coding for reimbursement. They were only allowed to see the patients once every 3 to 4 days, depending on how their ICD coding was in order for reimbursement from Medicare and Medicaid, mostly Medicare. However, if there was an acute injury, they would still go and see them, and they would do a short note, a non-billable note, and essentially just call it EMS. The one big tech piece that I saw there was communication. Every personnel had headsets that they could listen and communicate and immediately get a hold of any other staff. So if they were in a room alone and needed help, they would immediately get people right there. And it was just an easy way to facilitate patient care by having the communication lines between the staff. Topic 7, I'm going to go over medication concerns in the elderly. They definitely use Beer's criteria and try to minimize medications at the facility. They would try to wean them off everything that they possibly could that was safe to. So they were definitely working very, very hard to minimize risk and utilizing the Beer's criteria, which we did cover. The project that I essentially attempted to complete at the site was try to limit the barriers between the transition between the hospital and the nursing home. It wasn't fully successful. However, there are starting to use more discharge planners and coordinators. I did make a small little poster just for the main hospitals in the community if someone had to reach out to get information on why that patient was there. But it is definitely a huge hindrance, and they don't have in Colorado Springs, the primary computer system is Epic, and the nursing home wasn't able to front the cost for that. So most of it is cost-related decisions. The biggest surprise I had was the staff enjoyment and just enjoy working there. I worked in one SNF before a pretty long time ago, and everyone was definitely very satisfied with their job. The last message I have was I was immensely surprised with what kind of care they could provide and how well the patients enjoyed their stay, and many of them were definitely very sad to leave. They wanted to get out of the hospital. But once they were at the healthcare resort, they did not want to leave there. But the facility did an immensely wonderful job transitioning the patients back home into a normal way of life. Thank you.